And in our studios, we have the pleasure of having the delegate to Congress, Donna Christensen, is also a medical doctor. Dr. Christensen, how can Virgin Islanders reduce these negative impacts on our health?
Thank you, Winthrop, for that question. And I think I would begin by saying that we could do much better, we will have to do much better chronic disease management and prevention than we do now. Let's just look at heart disease and asthma, which we know that people who have heart disease and asthma will have much more difficulty tolerating these diseases when temperatures are warmer. And we need to have those diseases better managed. But we have a large population in the Virgin Islands that is at risk for heart disease. And we can begin now by preventing the onset of heart disease or making sure that if they do develop heart disease, that the symptoms will be less severe by reducing our weight, eating a healthier diet, more exercise, and making sure that our blood pressure, our sugars, and our cholesterols are better controlled. We also have a high incidence of diabetes in the Virgin Islands. And you can imagine that a person with diabetes and higher temperatures will have a much more difficult time controlling that diabetes. Diabetes uncontrolled leads to end-stage renal disease. And people with end-stage renal disease and any debilitated state or HIV and AIDS will have a very difficult time managing their disease in higher temperatures. There was a lot of talk about data, oceanographic data, geographic data, but we don't have very good health data. So we're going to have to do a much better job in the Virgin Islands at collecting data. But in the end, it's setting up a much stronger public health system and providing much better public health for our community. And for us to take more responsibility ourselves to improve our lifestyles and live healthier lifestyles.
If I may, Winthrop, let me ask the delegate one more question linked to your answer. With respect to the new health reform bill that has been passed that you were so instrumental in helping to move forward, how do you see climate change being able to be addressed through this? Would the community centers make it easier, you think, for us to address some of these issues in the territory when we have people that will probably have more need of them?
There are several areas where I think that the healthcare reform bill will be helpful. I said that one of the areas that we have to strengthen is public health and prevention. And there are many provisions that address that. First of all, there are provisions that would improve the public health infrastructure in communities like ours, expand the public health workforce. We will still need other physicians, nurses, health practitioners, community health workers, which are really very important, especially in poor communities or communities that just don't mix with the mainstream. And we have a lot of programs that would help to develop that workforce as well. We have programs that deal with obesity reduction and incentives towards obesity reduction. So there are a lot of programs that really change the dynamic from where our health system spends so much more on acute care than in prevention, spending maybe 5% of our healthcare dollars on prevention, and moving to the other direction where more emphasis is on prevention.
Thank you.
Well, thank you again. Dr. Carwood, how can the Virgin Islands reduce these negative impacts on our health?
Thank you for the question. I certainly underscore everything that Dr. Christensen has said, in particular in terms of the data collection. But I want to also reinforce the issue of awareness, information to the public, particularly targeted information to those persons in our community who are suffering from chronic illnesses that have been talked about, heart disease, HIV, obesity, so that those persons have the information that they can use to assist them when we do feel the impact of this. But also information for our healthcare providers so that they can begin to strategize ways of intervening and preventing some of the negative effects that we can anticipate that might come from the climate change and the negative impact on our health. We also need to work on having those policies changes within the health department and other departments that focus on strategies that will prevent and address these negative changes, so that there is a unified way of our tackling the problems that we can anticipate that we've talked about, and sort of link those with health and all of the other environmental issues that we've heard here this afternoon.
If I may, Winthrop, may I ask Dr. Callwood
Sure, please.
another
Go right
question?
ahead.
Thank you. Dr. Callwood, I know you are part of the nursing faculty at the University of the Virgin Islands. We've been talking about climate change and its impact on health. Mm-hmm. What do you think would work within our system so that we put out graduates from our nursing program who are already very strong, but how could we make them better so that they could handle some of these new kinds of challenges that are going to show up with respect to climate change?
Well, absolutely. Integrating information about climate change in the curriculum would be a very important way to raise awareness of all of the graduate nurses coming out, so that it won't be foreign to them, it will be second nature, and they'll know how to influence their colleagues who have come out before, and also be able to better address the needs of their patients.
Well, thank you very much.